Coming up next, you're going to hear from Ruth Pierce, who is a person who works as a reviewer, a field reviewer for a national accreditation company and has extensive experience in critical care and emergency type clinical settings. Our topic is congestive heart failure. We know that this is one that can lead to readmissions and a great deal of effort and expense within the healthcare system if it's not properly managed. Ruth, what were some of the key topics that we covered related to congestive heart failure?
Yes, Pat. Some of the things that we discussed were what are clinical practice guidelines? How do you know when they come out? What do they include? How are they important to the clinician, bedside clinician, as well as the providers? How do you find out about them? How do you stay up to date if when guidelines come out? How are they important to local clinicians and also globally? And then we also talked about how are clinical practice guidelines developed, who is involved in that development, what is the collaboration, what is the timeline for new guidelines, when can you expect new ones coming out? And then probably lastly is the implication. So what is the implication for both clinicians, practitioners who do not follow guidelines in management of care? And then what's the implication for the legal nurse consultant and their work and how they can review that?
All that in 30 minutes. Can you believe it? Be sure to listen to Ruth Pierce's podcast on the topic of clinical practice guidelines for congestive heart failure. You'll learn a lot whether or not you've got a case involving congestive heart failure or not. The process that she describes in this podcast is one that you can use in researching the current clinical practice guidelines in effect at the time of the care, and to get a bigger understanding of how these things come about, and also whether all hospitals and providers are expected to follow this, or whether you get an excuse if you're in a smaller rural hospital. Ruth answers that question. You need to come to the podcast to find out the answer. Ruth Pierce and clinical practice guidelines coming up next on Legal Nurse Podcast.